Joe, thank you. I'd like to bring in Dr. Purvi Parikh, an immunologist at NYU Langone Health. Doctor, always good to talk to you. Let's start right there where Joe left off with the J&J vaccine. For folks who already got that shot, who are hearing this news, are concerned about it, what are you telling them?
Again, it's extremely rare. Guillain-Barré is something actually that you can get with any vaccine, including the flu shot. And we don't yet know if there's a causal relationship. So we are seeing a signal of 100 cases out of 12 million. But again, we have 600,000 dead Americans. We have 4 million people dead globally. Your bet is still better to get the vaccine than not. Even knowing these risks, I 100% would get vaccinated, seeing the adverse outcomes of COVID, which are far more common.
What about somebody who got the J&J vaccine who goes, okay, well, I'd like to get the Pfizer or the Moderna next time around. Is that an option for them and something you'd recommend?
Absolutely. We're lucky in our country that, we have the choice. Right now, we have enough vaccines for every single American. So now we do have that choice where you can decide between brands. But, if you have J&J, it's not a bad vaccine. It's a great vaccine. And if you want to get it a second time around, if people who haven't been vaccinated are still considering J&J, I absolutely still advocate for it because it will still save your life. But yeah, we are in a much better place than the rest of the world in which we can pick and choose which vaccine to get.
Yeah, it's more of a PR mess for folks right now. Let's talk about the Pfizer potential need for a booster. It does seem like there is just a lack of coordination at the highest levels between these companies, the federal government, in terms of what we're supposed to do. I mean, for those of us who are doing our research, we're reading up, we're asking questions, we're talking to our doctors, it still feels like there's a whole lot of confusion as to whether we're going to need this. So what is most important for people at home to understand right now at this point in the process of the pandemic?
I know it's very confusing, but the most important thing to understand is, one, we need to see the data. If a booster is necessary, the nice thing that we are seeing where there is data is that these mRNA vaccines are showing very strong immune responses, possibly for years. Now we're testing in other vaccines, such as the flu, and even areas where the Delta variant is prevalent, these vaccines are still holding strong. So Israel, for example, yes, they did have more COVID-19 cases, but there was still over 90% prevention of deaths, of the hospitalizations, of the serious cases. So we can't really say yes, booster or no booster till we have those numbers and that data that it's definitely needed.
I hear what you're saying about the vaccine doing its job, but you look at the numbers with this Delta variant now representing more than half of the cases in the country. It's the dominant variant. So what concerns you about this, especially as we move into fall, if potentially we're going to go into another lockdown?
No, the variant is very concerning, especially in certain areas of the country like Missouri, where vaccination rates are lower. We're already seeing the healthcare systems there get overwhelmed. And again, those surge situations, which we saw at the start of the pandemic. And yes, fall and winter is a big concern. As people spend more time indoors, we see these virus cases surge. So again, everyone's best bet is to get vaccinated so that we don't end up in that situation where we have an awful winter as we did last year.
What about for those of us who are vaccinated or kids under 12 who are not able to be vaccinated? Should we continue to wear masks? Is that something that you would recommend, or continue the social distancing measures until we get out of this?
It's probably best if you're unvaccinated to, yes, continue to social distance and wear masks. If you are vaccinated, however, you may want to continue those measures, especially in indoor areas where you don't know the vaccination status of others around you, or if you live in a place where vaccination rates are very, very low, or if you live with people who can't yet get the vaccine, such as children under age of 12. So again, these are just guidelines, but you have to tailor them to your situation.
So many layers to fighting this continued pandemic. Dr. Parikh, as always, thanks for your time.